Good evening, friends. I'm Dr. Aajay Shah, and tonight we are bringing you Facebook Live with a special guest. As you all know, I sincerely believe in six pillars of healthy lifestyle, and those pillars include healthy eating, exercise, sleep, stress management, avoidance of substance abuse, and relationship. And definitely, many of these pillars, particularly the stress management, sleep, and exercise, sometimes require a very comprehensive approach. Not only we have to exercise, we have to manage stress with meditation, but it also requires certain other types of therapy and certain other types of management. And that's what we are bringing you tonight. Tonight, we are bringing you an experienced person, very knowledgeable person who's been doing her therapy for last almost 16 years. So we have a special treat. We have a person who's been very experienced and very knowledgeable. So please join in. Please have your questions and comments ready. We'll be taking live questions. So let me introduce Marin Wood. Let me introduce you, Marin Wood. So please welcome Marin Wood. Marin, go ahead and introduce yourself. Tell us where did you go to school and how long you've been doing and where you are doing this thing.
All right. Hi, everybody. My name is Marin Wood. I am a therapeutic bodywork practitioner. That's my official title. Massage is just one of the things that I offer. I have been doing massage therapy since 2004. It's going on 16 years here in August. So it's been a little while. It's hard to believe I've been doing much of anything for 16 years. I went to school. I received my certificate from the Naturopathic Institute of Therapies and Education here in Mount Pleasant, Michigan. And I've been working in or around Mount Pleasant for most of that time.
That's great. So let me ask you, what do you enjoy about, providing this specific therapy, which in my opinion is very important. So what kind of joy you get and why did you get into this thing?
Oh my goodness. How much time do you have? um, I really like every part of manual therapy just in general. I like working with people. I like building relationships with people. I like seeing their growth and change throughout our time together. All kinds of things. One of the things that I really enjoy about this industry specifically is that it is constantly changing. And a lot of it is turning from a lot of folklore kind of beliefs into evidence-based, scientific fact-based treatment situations. So that is really fun. To me, that kind of tickles my fancy because I really enjoy the science end of things. I like to see how things are put together, how they work in unison, all of that kind of stuff. That really satisfies me.
No, I think that's an excellent answer. I think not only like you said, massage therapy and massage treatment is actually getting into a main scientific field, many
Mhm.
medical benefits, many mental benefits, many spiritual benefits. And there are a lot of studies done now where people were randomized to receive massage therapy and not receive massage therapy. And there were some significant physical and mental benefits and many illnesses, which we will cover as we go. So I agree with you. I think it's coming into mainstream medicine now. So I'm glad we brought you on with an experience of 16 years. So let me ask you a simple question. Why should people get massage? I mean, that's everybody asks that. Is it worth spending money? Is it worth spending time, particularly with this social distancing and other things? Why people should get massage, not just now with this COVID-19, but when COVID-19 is resolved, why should people get massage?
There are countless benefits to massage that go beyond just the physical. There's a lot of emotional benefits that people can gain from that. People that experience, anxiety and depression, they can find benefit in massage. Just honestly, just physical touch is so important to human beings in general. There's a lot of as a society, we've kind of moved away from having that connection to one another. A lot of us, we work in cubicles and we keep to ourselves and we don't know our neighbors anymore. Like we just don't connect and bond with people in general anymore. So I think that having, you know, um, a knowledgeable person to go to for a therapy that's been proven effective, and to build a relationship with that person so you can connect on an emotional level. You can kind of bring those walls down and let your own self relax, to deeply relax, and also to have that safe place to go. To be able to do that, I think is incredibly important.
No, I think I agree with you. I think, like you said, the touch part is kind of going away because of a variety of reasons, including a lot of the medical legal reasons. And I think I remember when I was in medical school, all of our attending doctors and even almost all of us when we were in training, we were actually much more closer to our patients. We gave them hug, we shook their hands, we touched them as needed. And I think those things, unfortunately, are slightly going away for a right or wrong reason, but those things are going away. Obviously,
Mm.
with COVID-19, we many times are afraid of hugging and touching
Right.
and other thing, which is very appropriate. But at the same time, I agree with you. I think a lot of this bonding, a lot of this touch is going away. There's enough proof that when people hug, oxytocin hormone is released, which is very, very beneficial hormone, not just in terms of health, but in terms of cardiac or heart health, in terms of sleep, in terms of depression. So I agree, any kind of touch is very important. And if
Mhm.
that touch comes from a caring person who values your well-being, who values your growth, and if it becomes a regular person who has that touch therapy to you, I think there is a tremendous benefit long term. Matter of fact, whenever I read any successful person, whenever I read any successful person, including my favorite person, Robin Sharma, who is a very major motivational speaker, world famous, has written like 15, 20 books. And one of his one of his recommendation when he does this very expensive motivational seminars, that every participant has to get a massage once a week. That's his requirement. He puts massage as that important that everybody should get a massage once a week for 1 hour. And when he speaks, I can hear that he means it. He utilizes that therapy and he actually advances and grows because he gets massage no matter where he is in the world. He's a very big traveler. He travels all over the world to prepare his books, prepare his lectures. And wherever he is, if he's in Rome, he finds somebody to get a massage in Rome. So I agree with you. Massage is very important part of our lifestyle. So let me
Mhm.
ask you next question. Uh, uh, how often someone should get a massage? Is it once a week, twice a week, once a month? What is your recommendation?
That really, honestly, that kind of goes on an individual basis. It depends on what you're looking to get out of the massage. If it's something that, if you want to have that as a part of like your wellness regimen, if you exercise so often and you eat healthy and you take your supplements and you do all of these things and you want to add massage into that, then they say maybe, once every 3 to 4 weeks, just as a good, like go in, get relaxed, get uh, take advantage of all of those benefits of massage at least once a month.
Once a
But
month.
if someone has, if they have an injury or they're recovering from something, or that's definitely something for you and your therapist to decide together. But it could be more often.
I think I agree with you. I think once a month is a good start because
Mhm.
it's cost effective to do once a month. And then you can try it out and see how often you need. And like you said, if you are athlete, you may need more often. Actually,
Mhm.
I remember reading autobiography of a great marathon runner from Africa. I forgot his name now, but he actually runs every day or 5, 6 days a week, and he gets massage every day because he runs like 10 to 15 miles every day at a high pace. He trains pretty much 8 to 9 months a year, and he is like top three in the world as a marathon runner. And he
Nice.
says that he gets massage every day. Obviously, he can afford it. He requires that kind of massage because he's physically very active. So I agree with you. I think depending upon your needs, physical needs, mental needs, spiritual needs, you can start with once a month, and once a week is a fair call, but more than that, you have to have a specific need for it. I agree with you. That's a
Mhm.
good answer. So let me ask you another question. What are some of the things where a person should be afraid to get massage and get a clearance from his or her doctor before going to a massage therapist?
That's a very good question. Right now, for sure, anytime that you've been exposed to anyone with COVID-19 or been around or into one of those exposure sites, you should definitely get in touch with your physician and make sure that you are cleared and safe to go. Um, in general, if you have the big ones are if you have osteoarthritis, if you have cancers of any kind of clotting diseases, um, you know, uh, heart health complications. They're not reasons to not get massage, but they are definitely things that you want to bring up because they require special needs within the massage itself. Like you're not going to give someone that has, a clotting disorder or is on blood thinners, a deep tissue massage or a sports massage because that's going to be too much for them.
I think
Or
that
someone,
I agree. I think that's an excellent, excellent point. I think even though it may sound too extreme, but your first massage therapy appointment should be almost like an appointment with a doctor. It
Mhm,
requires, or appointment with a surgeon. In my opinion, that requires a semi-clearance from your doctor if you have a certain illness, a semi-preparation to bring your history to the massage therapist, and definitely writing down that history. Like you said, if somebody is on blood thinner, doing a deep tissue massage may be somewhat complicated. It may require certain care. It may require certain way of doing it. It can be done, but it may require a very specific way of doing it and special care. And that's where I think an experienced massage therapist comes in. Somebody who's been doing it for some time, who's been exposed to people with different kind of medical conditions, different kind of medications, and that's why I think I highly recommend to choose a massage therapist who is not just has a degree in massage therapy school, but also has some experience. Obviously,
mhm,
everybody starts new, but
right,
as long as you communicate with the massage therapist what your medical history is, I think massage could be a very safe option for almost everybody. I had a I had a C5-6 issue about 12, 13 years ago, and even
mhm,
with that, matter of fact, seeing a massage therapist actually helped me because I was doing physical therapy, I was seeing a surgeon, I was seeing my primary care physician, but they
mhm.
all recommended that if I go through massage, if I can somehow get my some of my muscle relaxed, it will help me. And I was doing it, and it literally helped. I was doing a lot of, maybe I can ask you also, I was doing a lot of ice massage, and maybe you can right now you can tell us that what are the benefits of, like, I know sometimes massage therapy means just using the fingers, but do people use like ice or like a hot bag or hot stone? Are those kind of massage beneficial also?
They definitely can be. Um, any kind of tool that is used during massage is for the benefit of the person receiving the massage. So most of the time, you will have a therapist who has like this. We call it a toolkit. You know, all the things that we can add on to massages to enhance the benefit. Sometimes it's hot and cold stones. Sometimes it's having like weighted heaters. There's also all kinds of things. There's like wooden tools, there's stone tools, all sorts of different things. Um, but there is always a reason behind using those tools. I find a lot of the people that enjoy the hot stones that I use. I use synergy stones that are handcrafted ceramic stones that have like actual benefits to them. There's different massage styles to use those with, and some of those can aid in like trigger point therapy and myofascial release and all kinds of different things. And using those, sometimes if you can um, stimulate an area with some heat to get that release and that comfort and bring up that circulation in that area. Sometimes you will find that it takes less of the muscle per se to kind of get that area released and relaxed and feeling better or put back into normal function again. So
Yeah,
it's
I think that's
oh,
a,
there's
yeah,
always a
that's a
tool.
good answer. I think I'm glad I asked you that question because a lot of time I also prefer that massage therapist has all the tools available, including hot and cold and stone and certain wooden tools. So I think
Mhm.
that's where I agree with you. I think selecting a massage therapist is almost like you have to do your homework. I don't want people just to go to massage therapists who can only do one type of massage. I think massage therapy is a very comprehensive science. And I
Mhm.
think person like you, and maybe you can help us to post on our page that what are the things a person should look for in a massage therapist. The
Okay.
next thing is, does massage therapy help sleep?
Absolutely. Actually, one of the things that I find one of the coolest things about massage therapy is that more than this is going to sound kind of out there, but more than the effects of massage have on your muscular system, just on the surface, massage really does its best work on your nervous system and getting you into that relaxed state, back to that rest and digest parasympathetic response. So that definitely will help to bring your body back down. It gets those neurotransmitters going in your brain that help you sleep. It's got many benefits surrounding sleep. Yeah.
That's an excellent answer. I agree with you. I think whenever I've gotten massage that night, I sleep very well in general, but that night I slept extra better. I mean, I almost have a better deep sleep. And I
Right.
have given a talk on how to enhance your parasympathetic tone, and
Mhm.
that talk includes getting a regular massage. I agree with you. And I think again, thanks, Maureen, for coming on. For all the people who are watching live, please share on your page so other people can watch it with your friends and family. Definitely invite your friends and family, like our page. This video will be on YouTube probably by late tonight or tomorrow. So you can watch it again if necessary. Ask questions and comments right now. I'll be going through all the questions and comments before we finish this live. And definitely reach out to our YouTube channel. We have a lot of videos, and this video will be on YouTube too. So again, thanks, Maureen. Let's go back to the next question. Again, we covered the sleep. What do you think in terms of benefits of massage as a stress reliever?
Well, going back to kind of tapping into that nervous system response, if you can find a way to stimulate and trigger in that parasympathetic response in your body, it helps to bring you back to that homeostatic level in your body. So that's when true healing and repair of your body can take place. So anything that you can do to achieve that, I think, is beneficial, and massage is definitely one of them.
I think I agree with you. I think when a person is going through any kind of, I call stress or mental disorder, depression, anxiety, panic disorder, it has to be a comprehensive approach or treatment that includes obviously exercise, seeing a counselor, getting
Mhm.
in the sunlight, appropriate sleep, appropriate healthy eating, whole food, plant-based. But I definitely think that that includes getting a massage therapy also, because that 1 hour massage a week can be a really a stress reliever in my opinion, and that could
Mhm.
probably as complementary as seeing a counselor in my opinion, because counselor will guide you through analyzing what you're going through and will give you some suggestion how you can figure out what your anxiety is and see how you can overcome that or what depression issues are. But at the same time, massage therapies without speaking a single word can enhance all those intrinsic coping mechanism, even without speaking a single word. And like you said, can enhance the parasympathetic tone. And parasympathetic tone has been shown beneficial tremendously into many mental disorders, many anxiety, many panic disorder. Even it has shown benefits in obsessive compulsive disorder. So I think a parasympathetic tone, if you have a high tone of parasympathetic activity, it makes you live long too. So I agree with you. I think massage therapy is definitely beneficial as a distressor. And like you said, as much as it gives you a physical benefit in terms of muscle, it also gives you benefit in terms of nerves and also your mind and your subconscious, unconscious mind. That's a
It
great
is
answer.
very holistic
Very holistic. Yeah, that's
therapy.
a better word. Very holistic. Yes, yes, yes. So I think we partly covered it, but let me ask you, if somebody is athlete, like many high school students, even many adults, many older people who are regular runners, who lifts weights regularly, who are physically very active, Do you
Mhm.
think they should get massage on a regular basis? And how often? I already answered that question that the marathon runner gets a massage every day. But what is
Mhm.
your recommendation for high school athletes and some of the adults who are physically very active?
I would honestly say I kind of the same. I mean, it's really something that is on an individual basis because everybody is going to respond differently for the level of their activity to the needs and expectations of what their goals are. If their body seems to respond better to having 2 or 3 massages in a month, or once a week, or twice a week, or whatever it may be, then that would be definitely the recommended time.
No, I think that's a good answer. My next question is a little bit of a question which many massage therapists may not like, but maybe you are the person who is an exception to that rule. I always ask my massage therapist that why don't you teach me how can I self massage every day, so that way I have to come to you maybe once a week or twice a month or once a month? Because I think I've seen many people, I've read many actually stories where people, including my wife's father, I'll tell you his story. My wife's father used to do self massage every day with oil. He would
Mhm.
wake up in the morning, he would exercise for half an hour, 45 minutes, and then he will take the oil, he will have certain tools, and he will self massage his body every day. You know, in
Mhm.
India back then, massage therapy wasn't that much available, and he would self massage every day. So, to my question to you is that if someone comes to you and ask you how can they do self massage, so that way they need to only come to you once a week or once a month, and what things you recommend to do self massage?
I have workshops actually where I really encourage people to come and learn how to do self massage at home, to do self care at home. A lot of times we'll use massage balls and bolsters and utilizing like the walls for stretches and things like that, or even chairs at home. I love spreading that knowledge because it's it's but some people will joke sometimes that if everybody knew how to massage themselves, then they wouldn't come to somebody like me. Well,
Right.
I beg to differ because if they saw how much we cared about their well-being and said, you take these tools home, you go home, you work on yourself, and in between there's always going to be something that you can't do yourself. You can't, a lot of people can't cut their own hair. A lot of people can't do a lot of things, because they just can't get at those right angles,
Right.
and they
Right.
can't fully relax. That's a big one too. When you're busy doing something and thinking about things, are you really being able to like put yourself out of that mindset and fully relax and kind of turn things off for a while? Not so much.
Yeah.
So yeah, I
Yeah, I
actually,
think that's a good answer. I think the self massage and massage from a therapist are complementary, because obviously everyday massage financially is not possible, time wise is not possible, and it's just not, just not right thing to do unless you are like an athlete. But I think
right.
self massage can be done every day, and if the
Mhm.
self massage is coordinated with a massage therapist, there are complementary benefits. But I agree with you, whenever I do self massage on myself,
Mhm.
I'm not in the zone of getting the massage, because I'm
Right.
very conscious, I'm very active, I'm thinking how to do it. Plus, certain parts of the body I cannot reach, even though I have certain tools. For certain parts of the body, I just cannot reach. Plus, I may not be able to provide the same deep tissue massage as a therapist, because I may not be strong enough, or I may
Mhm.
not have the reach to certain muscles. So I agree with you. I think self massage, in my opinion, is critical. One should do every day certain parts of the body, but also it should be complemented and added with a periodic massage from a massage therapist. I agree with you.
Right. Another thing too about, teaching people how to do self massage and self care at home, from where I stand, I can't speak for other therapists, but for me personally, like, I want to give people the tools to be able to, take care of themselves between their sessions because I don't want to be, it's very nice that maybe my name is the first one that comes to mind when they, wake up in the morning and go, oh, that's the crink in my neck. Oh, I have to go see Marin. That's very nice, but I don't want to have to be that person that you call because you're not feeling well. I want to be the person that you call because you want to continue to feel well.
Yes,
That's
yes.
part of someone's wellness regimen, not just a, quick fix, put a band-aid over it. Oh, you got to
Yes.
fix my shoulder today.
I think you made a good point that massage therapy is almost like a preventative thing. I think by the time you are in pain and go for massage therapy, even though it will benefit you, I think you are utilizing massage less. I think massage should be done when you are feeling well, so you continue to feel well instead of wait until something absolutely becomes like a requirement or an emergency. I agree with you. Massage therapy should be used as a routine instead of just an emergency call. I agree with you. Next question is, people ask me about this deep tissue massage. What is deep tissue massage, and are there any specific benefits to deep tissue massage versus just getting a regular massage?
Traditionally speaking, deep tissue massage is more of an intense pressure massage or a sports massage, where you have a sustained pressure for a longer amount of time, or you use greater amounts of pressure. You do broader strokes. You target certain muscles and certain groups and things like that. Deep tissue massage, it's kind of, for me, it kind of feels like a gray area, because I don't necessarily believe that deep tissue massage should be an entity on itself. I think every massage, whether it's light pressure, deep pressure, or anywhere in between, the therapist should have, you know, the most beneficial things that they can do for you in the time that you have together. That should be their goal. They should be, focusing on doing everything that they can for you in that time. And if that means that, in some areas you increase the pressure and you change the way you're doing things, then you do that. If you pull in some tools from your toolkit, then you do that. It's all of these things are available to us to be able to serve people in that way. So I don't necessarily believe in traditional deep tissue massage, because I think that has a place in all kinds of massage. That any massage that anyone receives at any time, or any therapist is giving, should be therapeutic. And I use that word kind of loosely, but you should be, the goal of the session should be to get that person feeling better than when they came in, for sure. And using every tool available to do that, I think it's necessary. So
I think that's a, that's a good point you are making. I think as a therapist, as you start to feel and touch the person, there are certain areas may require deep tissue, certain areas may require soft massage, and depending upon person's comfort and person's needs. So I agree with you. It cannot be like when I see people saying that I'm going for a 1 hour deep tissue massage. In my opinion, that's not a right title. I think many times the title should be, I'm going for a massage. Let the therapist decide what should be included in that massage. And part of it could be deep tissue, part of it could be other methods. And that's what I think I agree with you. I think many massage places I go, and they have a title, deep tissue massage, whatever, money, 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 and people choose that. I think to me, instead of that, they should ask the therapist that please work on what is required for my body instead of asking for specifically deep tissue massage. I agree with you. Yes,
yeah,
yes.
I have clients of mine that will ask me what the difference in the different kinds of massage are, and in slightly a joking way, I I tell them this. I use this analogy of getting through a door. Like, there's a door and you need to get through it. That's the goal of the session, right? And it's just a normal, boring door. It's got a knob on it and a frame. And I say that there are a couple of different ways that we can get through that door. We can do that by, body slamming and using our elbows and kicking and pushing and crashing through this door, right? Using lots and lots of intense pressure and getting through that door. Goal is accomplished.
Yes.
But if you're a person like me, you can say that I have this acquired set of skills where I know that I can reach my hand out, grab that knob, turn it 30 degrees to the right, and I'm through that door with minimal amounts of effort on anyone's part. You know what I mean?
Yes.
So
Yes.
that always
No,
seems to
that's a
be
good
cool.
analogy. I like that analogy. Yes, 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 yes.
collateral damage that
Yeah,
way.
I've seen I've seen some massage therapists who are literally, to me, are dangerous. I agree with you. I think going through that door is requires a specific method, and I think unless
Mhm.
the therapist is experienced, you don't want to go to some therapist who's going to start pretty much, to a point where he's going to hurt you in terms of physical, joints and other things. Particularly if you have any kind of a vertebral issue like cervical spine disease or anything like that.
Right.
I agree with you. So uh, my next question is like with this COVID-19, how are the massage therapists doing? Is in Michigan and across the country, massage places are opening up, and how people are taking the safety, social distancing, hand washing, wearing the mask, wearing the gloves. How is it working with COVID-19 for massage therapists, for their business, and for the places, not just in Michigan, but across the country?
Well, the every state is coming out with different guidelines. They all are looking to, the CDC and OSHA and their local Department of Health guidelines, and working with that and setting down kind of like a base requirement, right? So every state is a little bit different. There was even, I know Illinois for a short period of time, they came out with guidelines that they had to keep massages under 30 minutes for massages and estheticians and anyone who's working in close proximity with other people. That thankfully has been lifted because that doesn't. It's just 30 minutes is not is not enough time most of the time. Anyway, so unfortunately, social distancing and exposure times and things like that are a concern right now because massage therapy is you cannot socially distance and have a massage. It just cannot be done. So I would hope that every therapist out there, no matter what state they're in, no matter what clinic they're practicing in, no matter what they're doing, what their specialty is, I really hope that they are doing everything that they can to educate themselves about what this disease is, how it is spread, and what it can do to a person, and how we're seeing, some of these long-lasting effects coming out of, 3 months down the line, what people are facing after they've had been exposed to this illness. There are a lot of safety guards that people are putting in place, using air purifiers, checking ventilations in their rooms. Some people are choosing to wear gloves. Full PPE is definitely a fundamental guideline right now. Goggles, face masks. They're definitely recommending the respirator level, but we're waiting for those to be more acceptable. Yeah, it's an intense time to be a massage therapist, that's for sure.
Yeah, I think same thing applies to every field. Yeah, I think restaurants, doctor's office, when you go for a barber shop,
Mhm,
even the stores, everywhere. I think we are learning a new way of living now. I think
mhm,
when we commute in terms of train and plane and bus and
mhm,
everything else, I think we are learning new thing. And I think this will be a new normal. Even
mhm.
though I know a lot of people have suffered because of COVID-19, but I think this was a learning moment too. I think we are learning to wash our hands on a regular basis. We are learning to keep distance. We are learning to wear masks when we are sick, so we don't spread our infection to other people. And this may continue even when the COVID-19 crisis is over. Like I see that many people in Japan been routinely wearing masks in their public commute for like many decades. For last 20, 30 years, they've been wearing masks in their commute. And I think that may become a new normal in America, and there's nothing wrong with it. I think more
Mhm.
we take care of ourselves, more we don't spread our infection to other people. Why not? I mean, it's a part of public health, and it's as simple as wearing a mask and washing hands. Everybody should be doing, even when the COVID-19 is over.
Absolutely. There's no shame in protecting members of community, the people you know and the people that
Yeah.
you haven't met yet. Mhm.
Well, I'm going to ask you a very tricky question. What
Okay.
is the range of charges for people who want to get massage? Not your charges, but what is the range and what is too high where you should say, maybe this is too much for me to afford?
Oh gosh. Well, a lot of that depends on your geographical area. I know that, if you were, say, somewhere in the Upper Peninsula and offering massages, you may, have your rate set at, $40 or $50 an hour. And if you go, somewhere downtown Detroit or someplace, in Grand Rapids or a larger city, it may be $100 an hour. It really depends on your geographical area. It depends on the level of schooling of the people that you're seeing. If it's in a clinic, if it's on an individual basis. But the general going rate for most places is $1 a minute. That's usually what you can expect to see as a standard. But it definitely does differ depending on your area and what kind of
I
services
think
they.
that's a yeah, that's a good answer because our dollar a minute is a fair answer actually. I think like you said, some are about 40, but there are some which are 100, and I think people who have gone through those expensive hotels like Ritz Carlton, where it's like 225 an hour, but half of
Yeah.
the money stays with the hotel. Massage therapist doesn't get that money. He or she probably gets like 40 or 60 or $70, and
Right.
hotel keeps the profit. So I agree. I think if you find a massage therapist who works with you, just like working with a personal trainer who can be your regular, therapist, then that cost can be brought down to maybe between 40 and $80, like 60 an average per hour. I agree with you. That's a good point.
Mhm.
That's a good point. Yes, yes. Uh, so I think we covered a lot of the different topics, different ideas. I sincerely believe that massage therapy should be part of a healthy lifestyle. Minimum once a month. I think it's an investment. I get it myself. I highly recommend everybody, every successful person's methods I've read or their biography I've read, they all have gotten regular massage starting from last 2000 years. So massage therapy is not something new. It's been around. It's been very, very scientific. And I think person like you adds value, not just in terms of feeling good, but also health, mental, physical, spiritual. And I think also adds some kind of a relationship where, because many times, to be honest with you, while I'm getting the massage, the soft music playing, the slightly darker room, and a person almost puts me into like a different trance type therapy or zone type therapy. And many times, to be honest with you, even if the massage therapist leaves the room for 5 or 10 minutes, I'm still into that zone because many massage places, they have mastered how to make the most relaxing environment. Sometimes there's a little water fountain running in the room, there's a light music playing, there's a little bit of a darker light. So you almost feel like you are in some kind of a trance zone, even when massage therapist is not touching you. So I think it brings a whole comprehensive feeling whenever I go and have a massage. So let me ask you the last question. Any specific comment or concerns you have, and please tell us where you practice again, and if anybody wants to come and see you, how can they do that?
Okay. I guess the biggest thing that I want to say is relating to the COVID-19 stuff. I really feel strongly about educating yourself, looking for peer-reviewed articles and gathering as much information as you can to be a fully informed as much as possible person, because we are in an industry as well as many others where distancing is not possible, and our exposure rate is fairly high. We're in close proximity with people for extended periods of time. So it's definitely something that needs to, in my opinion, it needs to be on our radar to make sure that we are, providing the safest environment that we can for ourselves and for our clientele, and quite honestly for everyone else in the community, because we know how this spreads. So taking every possible precaution is going to help us sleep a little better at night. And if you would like to take a look at
No, that's
I have a Facebook page. It's Marin Wood LMT. If yeah, if you want to stop by and check that out, I work. I have an office in Red Bloom Yoga Center for Community Wellness here in Mount Pleasant, Michigan. I also have a private office in Okemos, which is just by appointment only. So you have to physically get a hold of me to make appointments there. But all of my information is on there, phone number and email address on that Facebook page. So look me up and get a hold of me, and we'll see what we can do.
That's great. Well, thank you, Maureen, again. This was a great, great conversation. Again, all our Facebook friends who are watching live and who will be watching later on, please reach out to Maureen if you are in that area. She definitely will help you out. To me, if I go in Mount Pleasant area, I definitely will go see her. Please invite your friends to like our page. Please reach out to our YouTube channel and definitely subscribe to our channel. We have now, I think, 72 videos, a lot of different topics, including health, including sleep, including happiness, including how to have a stoic life philosophy, many different topics. Our page actually is just not a health page. Our page is becoming more of a comprehensive page just to make you a more successful, more better person in life, and just live long, live happy, have a material success and have all kind of different kind of success. So please invite your friends and let's grow together. Let's enjoy life. Be safe with COVID-19. And let's say thank you to Maureen. Thank you, Maureen.
Thank you.